Kylie Vong. I'm Associate Professor in General Practice, and this is Dr. Rebecca Starkey. Rebecca is Senior Lecturer in our department. We'd like to welcome you to the Department of General Practice and Primary Care at the University of Melbourne.
The University of Melbourne is Australia's top-ranking university. Our medical program is a postgraduate, 4-year, full-time course. There are approximately 400 students per year, and we offer teaching and placement in general practice across all 4 years.
The Department of General Practice and Primary Care sits within the Melbourne Medical School. Through our research, partnerships and education, we work with communities and practitioners to improve the healthcare system, placing the person at the heart of healthcare and improving health outcomes.
Our department is one of the largest departments in the medical school. We are leaders in primary care research in Australia and received over $18 million in research funding in 2024. We have strong partnerships with a large community of teaching and research general practice clinics and use primary care data to drive research and policy.
There are several different theme areas where we have large teams of researchers working on both quantitative and qualitative research. The Sexual and Family Violence Program, the Children and Young People's Program, and the Primary Care Mental Health Program also have strong ties with consumers and use co-design in their work.
The Cancer in Primary Care Program explores cancer across the continuum from diagnosis to long-term care. The HABIC and data-driven quality improvement program areas focus on the use of technology and data, for example, for diagnosis and management of chronic disease in primary care and to evaluate the effectiveness of interventions.
In addition to these large theme areas, we have a number of developing research areas, including medical cannabis, integrative medicine, refugee health, and various aspects of women's health.
The department has had more than 50 academic registrars. Many have continued to teach medical students for us. Others have become more deeply involved in research. Some have gone on to complete a PhD or come back some years later to do so. Some have undertaken leadership in primary care training through initiatives available through this university. During your academic year, you will have the opportunity to tutor clinical skills to medical students, participate in the delivery of workshops, mark written exams, and give student feedback on written assessments. Across the year, you will also have regular meetings with GP academics from the teaching and learning team to strengthen your understanding of teaching and learning principles. You will also have the opportunity to enrol in the Melbourne University Teaching Certificate.
My name's Libby, and I was an academic registrar at the University of Melbourne in 2021. I trained overseas in New Zealand for my undergrad, and so when I came to Melbourne I didn't really know much about the reputations of the different universities. So when I reached out to the University of Melbourne about doing an academic post, I was just met with great enthusiasm and support, and that really carried through into my experiences of being an academic registrar.
My name's Emily Thrower. I am a current academic registrar at University of Melbourne, and I have been here across 2024 and 2025. I chose University of Melbourne for my academic registrar post because I completed my honours here back in 2014. I just found that University of Melbourne had the best supervisors that I wanted to be involved with, and the projects that I was the most interested in.
I think the most valuable part of being an academic registrar at the University of Melbourne is the really collegial atmosphere of the department. Everyone's really interested in everyone else's research, despite the fact that there's a really wide range of research areas that are covered in the department. And everyone's keen to support you if you have any questions or things that you're struggling with in your research.
Something I've found that's been really valuable during my academic post time is the time spent with other academics learning about fields that I wouldn't otherwise be in any way exposed to or aware of. Research Matters on Wednesdays, Friday morning tea.
Whether you have no experience whatsoever in research or you've already got a bit of experience under your belt, you have access to training sessions and supervision opportunities. There's a great range of research training and support available. So there's a qualitative research club which runs monthly. There's also the biostats team who provide support if you are interested in quantitative research. One of the great opportunities within the department is Research Matters, which is a weekly meeting for academics and students to come together and talk about research that's happening around the department. So we have a different presenter every week, and people get to share the amazing research that they're doing and get feedback in a very supportive and collaborative environment.
The University of Melbourne campus is very light and open. It's also very close to the city, which is convenient for me.
I think one of the really standout things about the University of Melbourne is that the culture of the department is incredibly friendly and supportive. I found that everyone that I talked to was really passionate about getting young GPs involved in research and really keen to help me pursue my interests.
Something I found really valuable about doing the academic post at University of Melbourne is the flexibility of the teaching that is available. So I have been involved in marking third year medical student assignments, producing questions for those assignments, as well as being involved in group activities.
I see the academic registrar post as a bit of a springboard to a career as a clinician researcher. I was lucky enough to be able to continue on with a research group that I started out with as an academic registrar, and I'm now doing a PhD in the same space.
Once my academic post is finished, I'm going to be continuing in the department in my PhD, where I'm being supervised by the head of department. So I'll be here for a few years yet.
I would highly recommend the academic registrar post to others. It's been a fantastic opportunity to me and a springboard to other opportunities.
I would definitely recommend an academic registrar post at the University of Melbourne. The range of supervision available, the size of the department and the facilities available were just not comparable to other sites that I was looking at.
We believe that general practice is the backbone of the Australian healthcare system and requires research specific to primary care. Undertaking an academic year in the department at the University of Melbourne will develop your research, teaching and leadership skills. We want to support and nurture the next generation of general practice academics. Please reach out to us.